Well, good morning, everyone. Welcome to the webinar today, Weighing Placement in a Pandemic. My name is Melissa Klabe. I'm the Director of Education here at Alzheimer's Orange County, and it's my pleasure to serve as moderator for today's panel discussion. Today, as you know, we're going to be talking about a difficult subject. Sorry, I lost my notes here. The topic of placement of our loved ones with a cognitive decline or due to another reason that their home situation may not be offering enough support. And today will largely be a question and answer discussion. So we invite and encourage you to type in any and all questions at any time. And we hope to get to all of them today. But if you do have questions that aren't answered or maybe are a little bit too specific for us to cover today, we always invite you to call our helpline. We're available Monday through Friday. I will put that number in the chat. It is 844-HELP-ALZ. And if you, ALZ, excuse me, and if you happen to have to leave a voicemail, we will call you back. So please do leave a voicemail. I placed a message in the chat if you can see that. If you have any technical difficulties during the webinar, I put a link in there for common troubleshooting concerns. You can also shoot me a question and myself or our coordinator Veronica will help you answer that. And there will be a recording of today's presentation if you miss any of it or if you want to share it with anyone else. That will be on our YouTube page, which I also put the link in the chat, but that will be sent to you in an email as well. Before I dive in, I do want to thank a few sponsors who made this event possible. First of all, our sponsor, Oakmont of Orange. They're a beautiful premier senior community. They're dedicated to hearing, understanding, and responding to the needs of aging seniors. If you're interested in learning more, we would encourage you to visit their website, oakmontoforange.com. We are super thankful for their sponsorship. We'd also like to thank the National Placement Referral Alliance, the NPRA, for their help in promoting this event, and their website is npralliance.org. And finally, a special thank you to Silverado Memory Care Assisted Living for their help in promotion, as well as lending us one of our wonderful panel speakers today. And with that, I would love to introduce our panel experts today, and you can see some of them on the screen here. So first up, we have Arent Light. Arent is a gerontologist and an administrator at Silverado Senior Living in San Juan Capistrano. She has 10 years of experience specializing in dementia care and supporting the needs of older individuals. She holds a master's in gerontology and a residential care for the elderly administrator certification, and we are so thankful for her spending her time with us today. We also have Carlina Baduri. She's a licensed clinical social worker. She's been our helpline coordinator here at ALS OC for a long time, assisting families, professionals, and the community with all things dementia related and more. She holds a family care consultations regularly, walking families through tough decisions every day, like the topics we're going to talk about today. And finally, we have Ben Allen. And Ben is one of our programs and education specialists here at Alzheimer's Orange County. He's also a longtime care partner for his wife, Judy, who currently lives in a memory care community. And so I'm very excited for his perspective today that we hope will be very helpful to the spouses and other family members and friends joining us today. Our goals for today are that each of you joining us feels supported and you walk away knowing you're not alone in the challenges you're facing. And we do hope to offer you some concrete and practical advice for the tough decisions you may be facing now or in the future. And we know that each person and family's choice is very personal and it's yours alone to make. And we're not here to give you the right answers today. We know that only you can make the best choices for your situations. But we are so grateful for you spending your most valuable resource with us today, which is your time. So thank you for being with us. And with that, I want to open it up here to our discussion. First of all, we wanted to kind of set the stage with a little bit of background information on the care options that exist so that we all kind of have a shared framework to start from. And so I'm going to go first to Carlina, and I was hoping you could kind of briefly walk us through some of the care options that exist and the ways that people fund them.
Absolutely. Excuse me, sorry about that. So when you start to think about what are some of the options, it's really important to know the different types of care that you can look at for your loved one. And families will use one or more of these at different times throughout the disease, and may find that some are better for their loved one than others. So, one of the first things that people often think about is in home care. So, there are lots of options for home care, and it can be something where you hire an agency or hire privately. We usually suggest hiring through an agency because it makes them the employer with all of the responsibilities. Though it can be more expensive per hour than some of the other options. For home care, it would be where you're having someone come in. It could be as little as 1 or 2 hours a week. For some families, it's up to full-time home care. It just depends on your individual situation. There are also adult day centers, and these can be social or healthcare models. They provide care during the day at the day center location. They often provide transportation for your loved one, and they can allow family members to have a break from the demands of caregiving or allow them to continue to work while their loved one can no longer be alone at home. Usually is much less expensive than hiring someone to come into the home during those same hours. There is also residential care, which is the placement care outside of the home. This can be you'll hear many things. You'll hear memory care for people who may need that additional support or a secured unit where they can't wander from. You'll hear terms like boarding care, which are the smaller 6-bed homes, more of a home-like environment, which and many of these options may or may not have a shared room. Depends on, again, finances and the individual facility. And there are the larger facilities, of course, out there that may have more activities. There's really no one right answer on the type of residential care. It's going to depend on your loved one and what their interests are, what their history is, before deciding which one would be the right one for your family member. Our helpline does have information and referrals on all of these topics, and we do discuss it on an individual basis every day with families. So if you find that you have questions on those, we can help you out with that. As for financing care, and that's a big one, that's one that we get a lot of calls about. There are many different ways that you can finance care. One, of course, is private pay, which is where it would be out of pocket for the family. There is long-term care insurance if individuals have a long-term care insurance policy. It's important if you do have this to read the fine print, to know under what circumstances it comes into play, what you need to do if you have an out-of-pocket expense before it picks up, and what types of places it covers. Um, if your loved one is a veteran or the spouse of a veteran, there may be some assistance through aid and attendance through the VA, and we can help get families connected to explore these resources. There's also Medi-Cal. Medi-Cal is a low-income insurance, but it also has long-term care for those who fall under a certain income level. And it does cover long-term care either in a skilled nursing facility or under what is known as the assisted living waiver. But there are specific guidelines for that we can also talk to families about how to apply for that, when to apply, and where to get support in knowing if your loved one qualifies. There may also sometimes be grants that are available or special programs to assist with things like adult day centers or home care. Such as for home care, there's the in-home support services. And again, we have information on all of this that we can talk to families about.
Perfect. Thank you so much, Carlina. That's really helpful to kind of start our conversation. And I also wanted to mention that there is a handout that's available for you to download if you click on the handouts tab. It's kind of an overview document of it's called choosing a care facility, and some good questions in there to ask. Some things we'll probably cover today, but just for your reference so that you can all have that. Um, this is an important question, I think, Carlina, and you could probably uh, speak to this, that we get this question a lot. How does someone know when it's time? right? What does that mean when it's time to think about placing a loved one? And I think each of you has a great perspective on this.
Mhm.
So I'd love to start with Erin for this one, and how you kind of go about counseling families and talking through this decision, and then we'll kind of go around the ring.
Sure. Hi, everyone. Just wanted to give a real quick background on Silverado. We are a standalone memory care communities that combines medical services and social model. We have outcomes-based programming that helps to improve quality of life, and residents can live with us from very early stages all the way through hospice until they pass. So if you have any other questions about that, I'd be happy to share afterwards as well. But in general, when families are coming to us, we ask them, how are they feeling in the home? Have they become a caregiver to their loved one already? Many times we feel a sense of responsibility, which comes with the great love that we have for our loved ones, whether it's family or a close friend. Um, and we take on quite a bit of responsibility, but the stress that's involved in it being an informal caregiver can really take a toll on both the lives, that the person who is assisting in the home and the person who is experiencing the decline. So I do ask families, do you feel like you're still the husband or the spouse or the child, or are you the one doing all the care? Because most likely many of those providing care, you're either have a full-time job or you could be retired, and this is now your full-time job on top of everything. So we just ask families, there's a few red flags that we try and look for. If you're having to put in a lot of implementations in your house to keep somebody inside, or if you're having to take away car keys, or if they are becoming a danger to themselves, and just remembering that it's not anything that's their fault, but that they are needing that higher level of care. And if you think about the way that we as society address treatments, if you have an issue medically, you go to the physician. If you have an issue with how you're living at home and you need that extra care, then you would need to seek out some extra support. So I know it's a very stressful process, but the most courageous thing you can do for your loved one is to admit that they would want to provide the help that a community could provide, or at home, all the options that Carlina expressed. And so that piece of it, being able to acknowledge that they do need more help than what we can provide on our own, and giving them that level of care that they deserve as well.
Thank you. Ben, would you like to share?
Yeah, a couple of things. One, how do you know when it's time? We could see it coming. Um, I struggled for quite a while to discern when was the right time, but we knew it was going to happen. So and when I say we, my wife's two daughters and I had been discussing, and fortunately we're on the same page, which isn't always the case in every family, and that can be a challenge. But we're really fortunate in that everybody was in agreement that was the direction we needed to go. Um, and as I evaluated that, actually I was in the Savvy Caregiver series at the time, and looking at a decision making process and evaluating, um, would would Judy get better care um, if she were in a full time care situation? Would I be in a better place? And the answer to both of those was yes. So I could see that it was going to be uh, certainly in less than 6 months, but didn't know exactly until paranoia became a really serious factor. Um, Judy became very, very agitated. Um, was convinced that there were other people living in our house. Um, and she got to the point where she was just so upset that she wouldn't let anybody help her at all. She literally barricaded herself in the bedroom, and we couldn't do anything help her. And so at that point, that day, I remember sitting in the living room with her oldest daughter and looking at each other and said, "Is this the day?" And we said, "Well, what other options do we have?" And so that's when we called the memory care that we'd already lined up. We'd made the decision, and said, we need help today. So that's how it happened. Another factor was that Judy was having difficulty swallowing medications, and so we were doing the typical crushing medications and mixing them in a variety of different foods, ice cream, applesauce, yogurt, lots of things, and she would just refuse to take them because in many cases those medications just taste terrible when they're crushed. So we really needed help with people who understood how to manage that to ensure that she would get her medications. And so as it turned out, that was really a good decision.
Thank you, Ben. Carlina.
So I just want to add a little bit on to that because I absolutely agree with what Aaron and what Ben said. It's important to know there really is no one right time to consider placement. However, many families explore care outside the home when the disease makes it too hard to provide the care they need at home without support, or when there are safety concerns such as wandering or behaviors that can't be managed at home while keeping everyone safe. For every family, it is going to be different. Sometimes you have to be able to continue working, and day centers or home care may not be the right option for your loved one. And right now, of course, with the pandemic, day centers primarily are closed. Other times, families will find that they cannot be the caregiver they want their loved ones to have. And this, I think that is something, excuse me, that Aaron had mentioned. It's okay to want to be the daughter again. It's okay to want to be the spouse again. And it's really hard to be there emotionally for your loved one when you've become the 24-hour caregiver. There's not a lot left of you to be there and be that emotional support that only you can be. I often suggest to families to think about placement before you ever needed it. And Ben, this is something that you alluded to, that you'd already chosen a place and you found that it was a lot easier to recognize when it was time. But you also don't want to be making a hard decision under a stressful time or an emergency. You really want to keep in mind the limitations you may have as a caregiver, or what type of direct care you may be uncomfortable providing. For some people, this may be bathing a parent or coping with incontinence. And it's not wrong to say that I have limitations as a caregiver of what I can do for my family member. Sometimes it's hard to recognize when you've reached that point of being overwhelmed, unless you think about these circumstances under which you would consider placement before it happens.
Let me comment just on the changing role, as both Aaron and Carlina said. When I relinquished that role of primary caregiver, then I became her husband again, and that was really, really significant. And I didn't understand that until a friend talked me through that and helped me to realize that my responsibility was to ensure that she was cared for. That didn't necessarily mean that I was the one to do it, or that I was the best one to do it. Many times we want to think that nobody else can care for my loved one as well. Well, I came to understand that just wasn't the case. That the professionals really could deal with the situations that I was just not prepared for.
Absolutely. Thank you all for that great perspective on that question. I think you all brought some really important points to the table. We had a question come in. I think this is for Erin. And somebody asked, do couples live in your community? So maybe you could speak about your community and then any others that you know of.
Sure, absolutely. Yes, we do have couples who do move in together. We've had couples who move in and they both have different levels of memory care. One of them might be have a higher cognition ability or maybe less ability physically. And so they're assigned to different caregivers, although they live in the same room. Sometimes spouses move in and they shouldn't be in the same room because there's dynamics or they're trying to help each other and they're making each other a greater fall risk than they need to be, for example. So there's all those different things. We also have what's called a well spouse. So, a well spouse would be somebody who possibly has a different comorbidity, so perhaps cancer, or just has very high needs of care, and they don't necessarily have a memory decline, but they're there in more of just a social aspect of bringing that quality of life that their spouse needs as well.
Perfect.
And Melissa,
Carly,
if I could just jump
absolutely.
in there with just one other thing that we see families often do. There are a lot of care options out there where they have the multiple levels of care. So they may be even in different buildings, but on the same property. There could be a place where there's an independent or assisted living, where the able-bodied spouse with what we would call normal cognition would live. And then there would be memory care provided for their loved one in a different, either on a different floor or a different location. But it really allows them to visit, perhaps if the other spouse isn't driving any longer, um, and still just wants to be able to easily visit their loved one. There are many options to explore.
Just want to add real quick,
Yeah.
many times spouses will want to participate in ways that the community really would discourage. So for example, giving medications to their loved one. So there's certain guidelines that we have to follow either
Mhm.
as an assisted living or an RCFE that would allow us to say, let us do the care, the level of care, so that we're responsible for that and they can kind of come and go as they please. So there's that part of it as well.
Great. Thank you so much. Let's switch gears a little bit and talk about maybe the elephant in the room, which is COVID. Unfortunately, this pandemic that we've all kind of been living through. And maybe, Erin, you can start with this one as well. What are some of the biggest challenges you guys have been facing? And is it safe for my loved one to move in right now to change their living situation?
Sure. We're hearing that quite a bit. I know there's so much in the news that's come out, and they do happen to find very sad stories to share, and they don't share the joyful ones. So, for example, in our community, we train our associates to appreciate that. It's called a pandemic for a reason. It's going to touch each of us at some point in our lives, whether it's a family member or somebody we know, or even be in the community. But what are the things in place that we have at the community to help prevent that? What safety guidelines are in place? And how are we doing those while still balancing resident rights? So, for example, are we still able to go on outings and maybe we're just cleaning the bus a little bit more? We're spreading people out in the seats. Are we still doing engagements and still having social distancing? Maybe at dining, we're not having 4 residents to a table. Maybe there's only 1 or 2 and they're seated 6 feet apart. So there's all these things that come into play with this, but it's a scary option to think about what happens if the community gets COVID. And I think people from tours that I've been on recently, many families are very concerned about that, and it's discouraging for them to think of that. But I just remind people, when you go to a hospital or a doctor's office or a clinic or the grocery store, all of these places have come in contact with some form of COVID. So if we're doing things like at our community where we're doing screening measures such as taking temperatures of all our associates on the way in, the way out, or we have KN95 masks that we provide to any associate or family member professional coming into the community. So we're able to reduce the spread through training, through safety protocols. And so those are the questions that you want to ask. What is the procedure for someone who needs to move into the community? Do they have a separate neighborhood that still has all the amenities? And they might want to have them stay with a one-on-one caregiver in a smaller area of the community for the first 14 days to make sure that someone's not coming in with symptoms, right? So that not only protects the resident themselves, but also the rest of the community for that safe kind of a slide into the rest of the community life. Are there separate observation areas? What if somebody has symptoms? How does the community handle that? So you can ask all these questions, and if communities or places of living, it's really important for us to be transparent right now, right? Everything's gone virtual. You can only get as much information as you can get over the phone or through a Zoom or online. Many places are not doing tours. We are, but it's community based. So it just depends on how the community is able to explain what's going on, and that should be something that's very easy. All of the communities are used to handling viruses, flu, norovirus, scabies. We're all trained for all of these things, and this unfortunately just adds another layer on top of that. But the masks, the safety precautions really do make a difference and really do protect the team and the associates and residents.
Great, thank you, Erin. Ben, would you speak a little bit to your experience of how it's been visiting Judy and kind of during this whole time, any kind of the progress that's gone on since March?
Yeah, progress is a good word. It's been an ongoing transition. I mean, initially, there were so many unknowns that visits were simply not allowed. And I understood that, although it was hard. I was used to being there with Judy almost every day for lunch. Food was our primary connection in those days, and so it was pretty disorienting for me to have to lose that role really overnight. Still, I was confident that she was getting good care. I wasn't worried about that at all. So over the succeeding months, it did change. There was a point where we could visit with Judy outside on a patio, and I would be outside of a wrought iron fence, literally on the sidewalk, and at least 6 feet away, more like 10 feet away, and she could hear me. Part of the challenge with her symptoms is that Alzheimer's has impaired her vision significantly. So she really can't see beyond about 3 feet. So while she could hear me and I could tell she understood questions and she would respond some of the time, she really couldn't see me. And whether she understood that her husband was there, I don't know. And I don't. I think I've gotten over that. The disappointment of potentially she doesn't know who I am. I know she recognizes my voice, and that may be that it's a familiar, comforting voice. I don't know. But I have come to accept what's real in the present and adjust to it. So most recently, the adjustment has been that now, given changes in our county, where family members are allowed inside the fence and have a visit on the patio. We're not allowed to go in the building, but we are on the patio, still 6 to 10 feet away. But it's a much more pleasant environment for me. Whether it makes any difference for Judy, I can't tell. She still hears me. She still responds, maybe half the time. And so our connection, while no longer feeding her is no longer an option, I can still play music. And most days I can see that she's enjoying that. I can just sense her settling in, and she starts to smile and clap as she enjoys the music. So it's definitely been um, a road with curves and don't know what's around the bend, but we just keep going down the road.
Carlina, anything to add about, I'm sure you're getting this question a lot from families about the safety and concerns about moving locations, and kind of how are you counseling these families or guiding them?
So, and I think that this has been covered very well so far, but there are a few things. We do hear this concern on the helpline a lot from families who are considering placement maybe because they aren't comfortable bringing caregivers into the home because of the fear that, maybe the same caregiver is going to other homes and could bring the virus with them. People are concerned about the news that they've heard about the virus spreading in skilled nursing facilities. And they also may be hearing that they're not able to visit. And so we encourage families to talk directly with the various facilities they're considering. And this is where the placement specialists that we refer to can be very helpful because they do collect information on things like visiting policies, understanding things like quarantine before and after the person moves into the facility and what that looks like. We want families to look into how are they going to stay connected with their loved one. Sorry about that. That would be my doorbell if you can hear it. We encourage them to um, check, do they offer FaceTime or other virtual visits? Do they offer in-person or socially distanced visits? Temperature checks. How are activities now offered to residents? Has that changed? Or are they still able to socialize freely with other residents? And one thing that I've often will suggest to family members is if they're not able to visit in person, check, can I send a regular care package to my loved one? Can I send cards? And keeping in mind that the time passing isn't the same for your loved one as it is for you. And so, yes, it's been 7, 8 months that we've been in this pandemic. However, for your loved one, they don't have that same perspective on time. Can I send pictures? Maybe send a voice recording. So I've had somebody send a teddy bear with a recorded voice in it, and other things that you can send to stay connected emotionally that can help you and your loved one. And I also encourage people to have that tough conversation of what happens if there's an outbreak. What are your procedures in place if exposure should occur?
Perfect. Thank you so much for that insight. We had a question about insurance. I think I'll start with Aaron here. Does your facility accept any type of insurance? What is the funding situation? Do you want to talk a little bit about that, Aaron?
Sure, yes. I know Carlina touched on this a little bit earlier. So we are a private pay community, but there are communities that do accept Medicare, Medi-Cal even. It just depends on those abilities. There is also a lot of people have opted into long-term care insurance. So whether families have started just 3 or 4 years ago or 20 years ago, a lot of times that is a really great benefit at this time. Many long-term care insurances, however, want to make sure that there's nursing at the place. So they oftentimes will tell you, oh, we can only accept or we'll only pay out for skilled nursing. But for a place like Silverado and other locations, we are having, we do have LVNs and RNs on staff. So we can make the point that we are capable of providing those medical needs that they would be able to approve family to receive those monthly benefits. There's also veterans benefits as well. And so there's the majority of it for us is private pay, and we do work with the families, of course, to explain how that works. Some communities outside of Silverado are fee for service, which means that they have a tier system. If you have this level of care, it's this much money. And as it increases, it becomes more expensive. Silverado is more of an all-inclusive. We understand that Alzheimer's is going to decline over time, and so the level of care coming into the community, the variation in that is really just based on level of incontinence or not, because the level of care we're providing is all encompassing. It's engagement, it's dining, it's in their rooms cleaning as well.
Melissa, let me comment on
Yeah.
insurance. One of the things that I realized after the fact is that my expectations were unrealistic. You know, in the early years of Judy's progression, we just assumed, I think, that somehow providentially we'd find a perfect person to come and live in our house and provide the extra support. I didn't realize that our long-term care insurance wouldn't have paid for that, that their requirement was that care would be provided by a licensed agency of some kind, whether it was in-home care or a live-in facility. And so an informal, family hiring an individual directly simply wouldn't have been possible, given that we were dependent on long-term care insurance paying for her care. Once that, all those details came together and we're working through the process with the facility and the insurance company, that has all flowed very, very well. The facility sends statements to the insurance company directly to verify that Judy received care for X number of days the previous month, and then the insurance company sends me a check to reimburse, but I pay the facility directly. And I hope that the insurance company pays on time so that I have the money to pay for the next month's care. But it almost always works out well.
Great. Thank you so much for sharing your perspective. That's really valuable. Um, Another tough question, I think that's probably been on everyone's mind at some point, is how do I come to terms with this? This is, I mean, as we've mentioned, one of the most difficult decisions probably families will have to make. I'll start with you, Ben, if that's okay, because I know that you've lived this. So, kind of take us through maybe just the different kind of phases that you've gone through and how you've kind of been able to come to terms with this difficult decision.
Mm-hmm. Yeah, when we first started considering placing Judy in some kind of residential care, it was really, really painful for me just to think about. I couldn't imagine her being in an environment other than in our home. But as I mentioned earlier, a friend helped me understand that I could become her husband again, and that she would get better care. So that was a major part of the process for me in adjusting to the idea. As we got closer, I remember very clearly an evening I attended a men's support group, and some of the men that were there that evening had already placed their wives in care, and I asked them, how do you deal with the loneliness? And one man looked at me and said, you've already learned to deal with it. Because at that point, it had been 5 years since Judy's diagnosis. And so I realized when he made that statement that I had been preparing for 5 years, because there was an increasing distance in our relationship, which is hard to say even now. But that was real. And so I was, throughout that period, adjusting, and still am, and becoming more comfortable with the idea. Um, and and then after, I'll just tell you more than you asked. And once we did make that placement, it was very painful, perhaps the most painful period of my life up to that point. Um, I'd visit her every day, and then I'd go home and cry. And at one point, I found myself saying, "This is killing me." But in that moment, I remembered a conversation with my counselor, who had given me some guidance on um, cognitive distortions that our thinking is incorrect. And one of a cognitive distortion is inflating things, and the term horribilizing, make it feels like it's just the worst possible thing, when in fact it's not. And so I realized in that moment, it wasn't killing me, it hurt. And I wasn't denying that it hurt. And so when I understood that, then I could begin to process and adjust. And it took a month or so to become more at peace. And part of that was seeing that Judy was settling in as well, and that she was getting great care. But it took time.
Really, really appreciate your honesty and vulnerability and sharing that, Ben. I know everyone's journey's different, but I think your perspective will be helpful. It's not an easy thing. It took some time, but you know that it was the right decision for you. Carlina, any insights that you can add, for families asking this tough question?
So again, we always encourage families to start the process of looking at out-of-home care before they need it. So again, they're not making that decision in an emergency situation, because in an emergency situation, you may not have time to really explore the options and process what this decision means or what your options are. And it helps you to know that you're making the best decision possible for your loved one when that time does come. I'll often remind families that if their loved one had any other medical need that required skilled care, that they would make sure that their loved one received that care. Alzheimer's and related dementias are no different than this, but it's harder to see the disease because the person in most cases still looks the same. I'll often talk to families and suggest making a pros and cons list of why to consider placement and which location to choose, because it can help you later when you look back, when you're having those tough days, to remember all of the reasons why you determined that this was the next step for your family. And do those reasons still exist? A lot of families find that they're second guessing themselves afterward. It's hard to come to terms with. And so, really, just looking at those reasons can help you to put it into perspective. The decision making grid that Ben mentioned earlier that we use in our Savvy Caregiver class, that is one that we often use in family meetings to help families have that concrete way to get their thoughts out on paper. And it can help them to, I don't want to say put the emotions aside, because you can never do that, but it can help you to move beyond just the emotions into that decision making area, which is really hard to do with what is primarily an emotional or an emotionally charged decision. It's also really important not to be hard on yourself. This is a major change for you and your loved one, and you need to give yourself time to grieve, because this disease is one that every change can bring grief, and it's important to allow yourself to feel and to process these emotions. On the helpline, we very often have these tough conversations both before and after a loved one moves into a care facility. And we really want to help families process this change in their lives. And it's important to talk about it. It's important not to minimize it. in order to be able to come to terms with it.
Thank you. Arent, I'd love to hear your perspective as well. And maybe you can also talk about another question we have, which is what if different members of our family aren't all on the same page on this? And I'd love to hear Ben and Carlina's perspective on that as well. But Arent, we'll go ahead and start with you.
Sure. Yeah, just to add a few things to how to come to terms with this. Nobody signs up for this. Nobody says when you're taking your wedding vows or when you're, helping out your parent that like, oh, when I'm 70 or when I'm 80, it's going to be really exciting. We're going to get memory decline. This is going to be great, and we're going to find a community. This is probably the most distressing decision you will ever make. And it's really important for those of us who are taking care of your loved ones to appreciate that. Where we're seeing some improvement, you're still struggling at home with, I can't take care of my loved one anymore. They are not responding the way they used to me. And you're having to reinvent your relationship on a daily basis oftentimes. And it is really difficult. And I try and remind families, if your loved one had a disease or an illness that didn't affect the brain, you would still have that person's identity and their entity, their personality, their characteristics. But because this is taking a toll on their level of cognition, the way their body responds, how they decline, we actually become sometimes strangers to those we love through this process. And it's very hard to come into terms with that. So we try and help families, sharing with them some different tips on how to reinvent your relationship. So for example, not coming into the community expecting if I just do this, they're going to be happy, right? Because their decline cannot be affected or is based on anything we can do. It's out of our control. We're going to grieve when they lose the ability to brush their teeth or to cut up food on their own or to use the restroom, right? There's a grieving process every single step of the way. And I think those support groups that Ben talked about, those are saving graces for our families, because we can tell you all day long, it's going to be okay, extend yourself some grace, try and get some sleep, how are you feeling? But to hear it from somebody else who's going through the same process and to be able to even share that, as Ben's sharing today with other families, really does make a big difference that you're not alone, because I do think in general memory decline is very difficult, and it's still not widely accepted topic of conversation for society yet, which is very unfortunate. As far as the other question, Melissa, if you can remind me.
Yeah, just if family members are on different pages, which I'm sure is more common than not, how do you deal with
Yes.
that?
Yeah. We encourage family members to call. We want everyone who is interested in being involved to be involved, but ultimately, um, whoever is the responsible party, so whether that's a power of attorney for medical, or if it's a conservator or a guardian or their next of kin, they're ultimately the one responsible. And 9 times out of 10, the person who's experiencing the decline, put them into a place of responsibility before the decline, right? So they chose you specifically for this. They wanted to make sure that should anything happen to them physically, cognitively, that they're trusting you to do the best, and that they trust your judgments so far in your relationship together that they know you're going to take care of them. And I think it's important to remember that everyone grieves differently. We have family members, children who don't want to come and visit because it's not mom and dad anymore. And that's really hard to watch your hero that you grew up loving, and just they're your mentor, and it's hard to watch that. And sometimes spouses are very upset with their children. Why aren't you wanting to come in and support me? So I think just appreciating that everyone grieves differently, and also appreciating when that time comes, whoever is in charge does need to be able to make the decisions that it's for the best interest of the person. It's not for the best interest of whatever the family believes, but what does that person actually need as far as a quality of life, a level of care? What do they deserve to have?
Thank you. And go ahead, Ben. Yeah, you go, and then I have a question for Carlina. Go ahead.
Um, As I said, I was really fortunate that our immediate family and I were all on the same page. Um, I never got any criticism from extended family. Um, what criticism I got was pretty veiled from friends and acquaintances, and in some cases support group members. I would hear other caregivers speak with pride about how they cared for their loved one at home to the end, and that's great for them. Um, what I picked up from that, maybe it was just my inference, that they looked down in some way on me because I made the decision to place her out of the home. Um, I believe, I think it's more than just my feeling, that there is a stigma around placement. I remember another men's group that I'm still a part of, an ongoing group, and I would report on how, at one point, how well Judy was doing, that she'd really made some improvement. And one of the guys said, well, couldn't she live at home? And I said, oh man, you really don't understand how complex this is. Yes, she was doing well, but that doesn't mean that she was getting better. People who would talk to her when she was still quite verbal and mobile and able to engage simply wouldn't understand um, why she needed that kind of care. But as you said, Melissa, she entrusted her care to me to know what was best for her. And I don't know that I've ever verbalized this to people who indirectly criticize my decisions. But in my head, I say, you don't get to vote. So thanks for the suggestion. I'll look into that.
That's a good line when we get unsolicited advice, I think, on many topics. Thank you for your suggestion. I'll take it into consideration. Carlina, I'd love to hear your input as well as this kind of feeds along with that, but somebody asked, are family meetings occurring via Zoom? So maybe you could talk about what we've been doing for family care consultations during this time.
Yes, so we certainly have family meetings that we offer by Zoom. And actually, that's one of the notes that I have going into this question, so I'll address that a little bit more at the end of this. One of the things to just keep in mind is that we almost always see that every family member wants what is best for their loved one, but they may not all agree on what that is. That's where those family meetings can be very helpful. It's also a good idea, if you're able to try, and we encourage families to do this long before the topic of placement comes up, but to talk to your loved one early on. Have those difficult conversations of what would they want? What type of care would they want if you weren't able to provide it any longer? Because it's really hard to be the one to make that decision for somebody else. And if you know that you're doing something that is in line with what they would have wanted, if they were able to make that choice themselves, if they were able to understand the situation, and that doesn't mean you can always reasonably do what it is that they voiced that they wanted, but it can help if you can. It really helps also, again, to have that pros and cons list that we talked about earlier, because placement can depend on a lot of factors, and it also can depend on a lot of factors as to who's making this decision and whose input you're going to value more than others. Who is already providing the direct care? What is their relationship with the person with dementia? Who's going to be financing the care? Things like that. When family members aren't in agreement with the decision that you have made, you still want to listen to them. It may be their denial or feelings of guilt that have them feeling this isn't the right choice. excuse me, they may also not just simply not realize the day-to-day reality of the care the person needs. They may talk to them briefly on the phone or see them very rarely, and that person may present very well socially, and that may be very different than how they're presenting at 6 o'clock in the evening, or when they're up all night and nobody can sleep. You want to have those difficult conversations of being able to explain why you've come to this decision, depending if it's appropriate to have that conversation, again, depending on relationship and involvement, and be able to tell them that this was not an easy decision to make. We've had people also just simply blame the doctor, that the doctor said it's time. We do help with these conversations. Again, when I mentioned that a lot of the times family members all want what's best for their loved one. They may just see what's best as slightly different. And so we can help to facilitate those conversations on why you've come to this conclusion, what are the concerns that led to it, and what does it really look like? Some people have, I don't want to say unrealistic, but they may not have a proper view of what placement means. They may still think of it as a sterile environment where you're putting your loved one or that you're giving up on them. They don't necessarily understand what it's going to look like, that you're putting them into a community where they will have others that they can still socialize with, that you're still a major part of their lives. And in some cases, you can actually be a bigger part because now you can be there emotionally for them. And so we really want to help families with those meetings. We can schedule them usually within a day or two notice, depending who's going to be involved. We do like to talk to every family member first before those meetings because we want everyone to have a chance to be heard. That doesn't mean that we discuss what one person says with another. Those conversations happen together in the meeting, that we facilitate that. But it really helps us to have an understanding of where every family member is coming from so that we can ensure that everyone comes out of that meeting, if not feeling that they've been the decision maker, that they've been heard and understood, and maybe they can understand why this decision is happening.
Great, thank you so much. We had a question come in. We've touched on this a little bit, but I'd like to ask this to Arent. How can a family feel that their loved one is safe? How can they be assured if they're not able to visit or see what's kind of going on? And I'd like to piggyback on this question too. Can I take my loved one out if I ever feel that that's the better decision?
You talking about taking them home, not just out for
Yeah.
an outing? Okay,
Sorry, yes.
sure. No, that's
Well,
okay.
maybe both.
Maybe both, yes. So first, the communities or placement places should be able to share upfront how this works throughout the pandemic because, for example, at Silverado, we don't have visiting hours. So we have families who normally come in breakfast, lunch, and dinner. They could be here 10 to 8 hours a day. And right now, for example, because we are having disinfecting protocols and making sure that we're cleaning between visits and that we're supporting the residents, they might be visiting just once or a few times a week or having a FaceTime and Zoom and an in-person visit outside, for example. But in general, just ask. We want to help you feel comfortable. We know that you need to have a great deal of trust to have your loved one with us. And it's really important that you ask for what you need. If you call and say, I need a photo every day for the next month, we will make that happen. There should really be nothing that is really out of the question, as just depends on the ability of the team to facilitate that. So for example, might be able to send you a video instead of a picture one day, or maybe we FaceTime instead of sending you a picture one day. But it really just, it's up to you. You have to ask those questions. If you need to talk to a nurse, or if you want to talk to, can I get an update from the caregiver, or can I hear what they had to eat today? We want you to feel comfortable, because normally at home with your loved one, you have all that information, and you might feel like you're being a bother, or that you're don't know who to ask. If needs be, if there's a social worker or a head nurse or the administrator, our goal is to support families, especially during this time. We only have one chance to do this correctly. So the fact that your journey is continuing despite COVID, that's the most important part to us, and we want to make sure families are feeling comfortable about that. So as far as taking your loved one home, couple things to consider. First is, are you taking them home because there's COVID in the community, right? Such as what we hear from families. In the past, it's been, if we have a flu outbreak in a community, I'm going to take my loved one home. So what we ask them is, are you prepared to do so? Do you have enough care in the home? Because most likely from the time they've been at home to now that they've been here, they've continued to have some sort of a decline, which means the level of care needed at the home is even greater than it was when you had them there. Also with COVID, the unfortunate part is sometimes symptoms don't show up for 14 to 21 days. And so also, are you prepared for that if they do happen to have contracted the virus or the flu? Are you ready for that in the home as well? It's more of a long-term commitment. Again, I know it's a knee-jerk reaction. Let me take them home, let me protect them. But to be honest, the best thing you can do is have them stay at the community, because the protocols that get put in place, assisted livings, for example, we report to the California Department of Social Services. So there's calls that we have every week with a licensed program analyst, or with an ombudsman, or with our company, and we talk about what's changing. What are they allowing us to do? How many days, if a person does go home, do they have to stay at home before they return to the community, for example? Would they go back into an observation area for 14 days before they can rejoin the part of the community that they lived in, for example? So really, it's what's available at your home that you think would be better to provide. So again, that fear of bringing somebody in who might be bringing in COVID, a nurse or a caregiver. So the best thing is to ask for the communication, the level of communication. Ask what's going on in the community, what's changed this week. Some communities have Zoom calls with families. Sometimes, for example, at our community, I send out a letter every week of what's changing as far as any protocol or safety precautions, and families will send me questions, and I'll just text them back or email them. So really is a difficult decision. So take some time to think about that before you do that, because ultimately you're going to be shuffling them if they get sick at home between the hospital and the home again, and the hospital and the home. And actually their decline most likely will increase more rapidly than it could if they were continuing their regular routine at a community.
And Arent, maybe you mentioned this, but what kinds of requirements are you under to notify families if there is an outbreak? How soon
Oh,
does that happen? What does
yes.
that look like?
Absolutely. So first of all, there's a couple of websites. The state website, for example, they actually post who's positive or not, or the county Department of Health. So in Orange County Department of Health, you can call them and ask, is there any positives at this community or wherever they're at? It has to be made public. That's part of one of the procedures put in place by the Department of Health, CDC guidelines, everything. So we have to share. It should be the same day. So whether it's a mass email or calling families individually, which I've done, sometimes it takes 4 to 5 hours, but if that's what we have to do, that's the most important. that's that piece of transparency that families need to know. You would know whatever information you could ask from a physician. If you go to the hospital, you should be able to have that same level of communication with those who are taking care of your loved ones as well.
Thanks very much. We had another question about decline. Unfortunately, we hear about, the isolation as well as the disease that causes decline. Arent, in your experience, since you're kind of on the front lines there, have you seen more decline in patients after, if they've had to quarantine for a certain amount of time or be isolated? I know it's tough, and we're all kind of hearing about, lots of people declining during this time, unfortunately. But any light that you can shed on that?
Sure. Silverado is unique in the fact that we cannot afford to isolate residents here. They have memory decline, and for me to tell someone you have to stay in your room all day or you have to eat, one, most likely they're not going to remember. I've said that after a lot of period of time, as early as 5 minutes or so, but also this is their home, this is their life. We just happen to work in their house. So they need to have that freedom and that access that they're granted, that dignity to be able to move indoors and outside as they would like to. So we hear stories of families who are traveling around looking at different communities. There are some communities who do enforce isolation. And you could have that just as easily in the home, right? So that level of depression or anxiety or isolation, we are creatures of habit. We are normally around other people. As we age, our circle becomes smaller, but the quality of social interaction deepens with those that we love. And so that's what we really strive to maintain. Nothing really has changed much at Silverado's except for the fact that we wear masks and we clean everything every day, and families have to sit further apart. So but as far as what the residents' lives are experiencing, there's no change because they still need to have the level of engagements and dining. So that's just something to ask at different places wherever you're looking. Other places besides Silverado are also trying to or putting in place similar procedures, but just remembering that isolation is a huge risk because not only are they confused about where they are, wherever they're at normally won't look familiar unless they have a lot of their belongings here, and most likely they won't have been able to input a lot of memories into their brain about wherever they're staying, and they're going to be looking for their loved ones. So a lot of times more behaviors will crop up. If there's isolation, it leads to depression and often a lot of confusion and agitation as well.
Yeah. Thank you so much. Carlina, a question for you. You had mentioned earlier placement specialists. Can you talk a little bit more about that? Is there a benefit for families? What does that look like to utilize the help of a placement specialist?
So the placement specialists and the ones that we refer to, because there are a lot of them out there, the ones that we refer to from our helpline are very well versed in understanding what dementia is, what are the needs of a person with dementia, and what are the needs of their families. And so these are the people that go out, they do these visits with the different care facilities. They know which one may be a better fit under certain circumstances. And they're going to come back to you with a short list of possible options for you to explore. Now, you're not under any obligation to choose one that they give you, but it is a very helpful way to narrow down the options because we're talking hundreds, even thousands of options, depending where you're looking. And it can be very overwhelming when you're already overwhelmed enough that you're at that point where you're looking at placement. Placement specialists do not charge the families for their services. And so what I talk to families about is yes, under most circumstances, if they find a place that you choose, they are going to get what is sort of a finder's fee. They get that if you choose one of the facilities that they refer you to, they get that from the facility. If you select that one, your loved one moves in and it works out, your loved one is staying there. So they are doing their best to make sure that they find the right fit. And by right fit, I mean the best possible fit for your loved one. So again, they go out, they do the legwork. They can help to make sure that you get your questions answered. That if visits are possible, that they're working with them to negotiate that for you as to what that looks like. Um, but I've found that the ones that we've worked with have been very helpful for our families. And also to understand what are some of the financial options if it's not affordable easily for you. They'll have those conversations about what to look for or what resource to look into applying for and how to do that.
Great, thank you. I want to give everyone another chance to type in any last minute questions. We'll probably wrap up here a little bit early today. I want to go around to each of our panelists today and just ask, we talked about what questions that I should be asking if I'm looking, thinking about placement. But just from each of you, kind of like to re-ask you that question again. What are kind of some of the most important considerations that you can think of? Ben, I'll start with you. Um, yeah, go ahead.
Yeah, it was a very interesting process for me. I found that some locations really sell their facility, whether it's new or they've got a cafe that's just really great and their food's great and all of that. But what's really important is the level of care. And for me, what I discovered is when I visited to watch the caregivers and the staff and how they interact with residents. And where we ended up placing Judy, it's just a beautiful thing to see the caregivers working together, and they clearly enjoy working together and like each other. And that just makes such a difference. And over the years that she's been there, it's just so clear that they love her. Um, that is such a gift, a blessing. But I would just say don't pay attention to the beauty of the physical facility. Um, where Judy is not fancy. It's homey, and it's a comfortable place for residents and for families. So just the attitudes of caregivers and other staff and how they work together was an important factor.
Great. Erin, you want to jump in?
Sure. Yeah, there's quite a few questions, and if I was looking for a family member, I would probably be one of those people who would take 2 to 3 hours asking questions. So don't hesitate to take as much time as you need. This is a really big decision, but you want to make sure you're getting the information you need. So, for example, normally, if you were able to come on a tour inside the community, pay attention to what's going on. How is everyone interacting? Is there a lively environment? Is it very quiet? How many staff do you see around the community assisting residents, right? And of course, we do try and clean house before people come and tour, but that's what we do anyways at our own homes, right? We do want it to look nice. But again, a lot of it is figuring out who is going to be your main point of contact. How are you following the CDC or the FDA guidelines for screening or for COVID, right? How are you going to maintain communication with me if I can't come in to the community? My best recommendation, families a lot of times want to share what's going on. So check Google, check Yelp, check Facebook pages. Families are very quick to post reviews one way or the other on how their experience is. And right now, Google and Yelp are pretty much some of the top ways to figure out how the feeling is inside the community right now. You can also ask the community to put you in contact with a current family member there. So that way you can talk to somebody and see how their journey was, how was their experience, what is it like now compared to what it used to be before COVID. But in general, whatever questions are important to you, right? What are the amenities? Be very specific on what you're looking for. And just remember that we're not looking for ourselves, because what might appeal to me might not necessarily appeal to my mom or my grandparent, right? So their level of needs and their care and how they're going to pivot as they decline as well.
Great. Carlina?
Are you able to hear me?
I can hear you, but your camera froze. That's okay. We're almost done. Perfect timing for
Yes,
a
I
technical glitch.
apologize for that.
No problem.
Um, so I think that Aaron and Ben have covered this one very well. I would suggest, though, when you do see a facility, a lot of the times family members will hear from them, well, my loved one would never like that. Well, it's important to look at it as who they are now with the disease, because that may not matter to them as much now, and some things may not be as important to them. Um, you know, have they always been a very social person may be very important. What do the activities look like? Are they easily overwhelmed by that when making the decision as to whether this is going to be the right fit for them? At the same time, though, it's really important to help the staff know who your loved one is, not just now with the disease, but who they've always been. It's important that they have that insight in who they are as a person, and you'll get a feel for how receptive the staff are. That's one thing that I hear a lot from families is, that they really took the time to ask questions about my loved one and not just talking about the facility itself. And so looking to see how receptive, how warm the people are. And there's a lot of things you can't do right now necessarily that you might have been able to do before the pandemic. And that may include a tour in some facilities. That may include bringing your loved one in to tour and see how they react if you're just going to visit. Talking to the facility about what the move-in process looks like right now in terms of the pandemic, in terms of visiting after the person is placed, either in the first couple weeks, the first month, or in general because of the pandemic. And I always encourage families to put together a list of questions before they go to visit, and maybe the same list of questions when they visit a couple different places so they can compare the answers rather than having to rely on their memory for those answers. And I always tell them to take a pen to write down the new questions that come up while they're there, or the information that stands out as important to them.
Absolutely. I think having a list is such a great idea. In the moment, we forget. I think a list at the doctor's office and a list, going to these appointments is very important. I wanted to mention one comment that came in from one of our very trusted community partners. She makes a great point. She says, when you're advising families to look online, please tell them to be careful not to enter personal information. There are unfortunately deceptive websites out there that may try and guide you one way or another, or steal your information. So that's a great point. Thank you so much for making that. I guess we'll go ahead and wrap up for today. And again, thank you everyone so much for joining us. I want to thank our sponsors one more time. Oakmont of Orange, thank you so much for your sponsorship. The NPRA as well as Silverado. Arent, thank you so much. And thank you to our panelists for spending some time with us. We really hope that this has been helpful for you. Again, if you have more questions, we really encourage you to call our helpline. Reach out to Erin if you have specific questions for her or Ben. You can email us at learn@alzoc.org. If you have any questions about today's presentation, you can call our helpline. And a recording of this presentation will be on our YouTube page, and that link will be sent to you in an email. I'm also sending out a survey that should reach you in an hour or two. We really value your feedback, so we'd really appreciate if you would take a couple minutes to fill that out. So thank you again, Ben, Erin, Carlina. It's been an absolute pleasure, and we'll see you all next time.
Thanks for having us.
Thank you, Melissa.
Thank
Bye,
you.
everyone.